You know, it's pretty wild to think about, but inside your body, right this very second, there's this constant tug of war going on. It's a battle that controls almost everything you do automatically. We're talking heart rate, digestion, you name it. Today, we're diving into two really powerful types of drugs that can literally jump into that tug of war and pull the rope in one direction or the other to help doctors get things back on track.
So, think about it for a second. How are you feeling right now? Are you amped up, wired, ready for action? Or are you calm, kicked back, and relaxed? Well, these aren't just moods. They're actually fundamental operating modes for your entire body. So what if you could medically flip a switch between them? Well, that's exactly what we're going to explore.
So, how does this whole master switch thing even work? Well, it's all managed by a part of your nervous system that you don't even have to think about. It's called the autonomic nervous system, and you can think of it as the silent operator running the whole show from behind the curtain.
And this operator has two main teams. First, you've got the sympathetic system. This is your go button. It is the gas pedal, the thing that gets you revved up for fight or flight. Then on the other side, you've got the parasympathetic system. This is your stop signal, the brake pedal that takes care of rest and digest. They are in total opposition to each other, creating this really delicate, crucial balance.
Now here's where it gets really interesting. We've actually developed drugs that can intentionally, hack this system. They can either slam on the brakes for you or completely cut the gas, all depending on what a patient needs. So let's meet these two agents.
First up, we've got the sympatholytics, and the name itself gives you a huge clue. That little suffix, lytic, it means to break or to block. So these are our blockers. They literally step in and stop those go signals from the sympathetic system. They're basically telling your body, hey, calm down, relax.
Then, on the other side of the coin, you have parasympathomimetics. That word mimetic, it means to mimic or imitate. So these drugs, they're the enhancers. They aren't blocking anything at all. Instead, they actually boost or copy the rest and digest signals, pushing your body even further into that calm, relaxed state.
Okay, so theory is great, but how does this all play out in the real world? Let's take a look at treating glaucoma. That's a condition where you have high pressure inside the eye. And this is a totally fascinating case because you can use these two completely opposite types of drugs to achieve the exact same goal.
Now, check this out, because this is where it gets really cool. The sympatholytics are blockers. They can reduce that eye pressure. But at the same time, the parasympathomimetics are enhancers. They also reduce the pressure. They just do it a different way, by contracting a tiny muscle in the eye to help fluid drain out. What's wild is that both of them end up making the pupil smaller, a state called miosis. But they get to that same result through different doors. So what's the big takeaway here? It's that whether you choose to block the go system or you choose to enhance the stop system, in this case you end up in the same place, successfully lowering the pressure inside the eye. It is a fantastic example of a two paths, one destination approach in medicine.
But of course, you can't just go messing with these fundamental body systems without some side effects, right? Because these drugs make the pupil smaller, it's pretty common for patients to get blurred vision or even find it hard to see in low light. It's a direct result of the very thing the drug is designed to do.
All right, so let's switch gears and talk about the lungs. Because, believe it or not, what works wonders for the eyes can be a really serious problem for your airways. In this case, the story takes a completely different turn.
And here is the big issue. In your lungs, both blocking the go system and enhancing the stop system lead to the exact same dangerous outcome, bronchoconstriction. And that's just a fancy word for your airways tightening up, which, as you can imagine, makes it a lot harder to breathe.
But hold on, it's not quite that simple. Not all of these blockers are the same. You have what are called non-selective beta blockers, like propranolol. They're kind of like a shotgun. They block the landing spots for adrenaline in both your heart and your lungs. That's a huge risk for someone with asthma. So doctors can use more targeted cardioselective blockers, kind of like a sniper rifle. But even those are used very, very carefully.
And for those enhancer drugs, the parasympathomimetics, the warning is even more serious. I mean, the source material puts it bluntly. It says they are generally contraindicated in uncontrolled asthma. That's not just a small caution, that is a major red flag. Giving a drug like that to an asthma patient could easily trigger a very severe attack. So let's just step back for a second. What have we really learned here? We've seen how these drugs can be the absolute perfect solution for one part of the body, the eyes, and a potential disaster in another part, the lungs. It really all comes down to a super delicate balancing act. And really, that's what it all boils down to. Sympatholytics and parasympathomimetics are incredibly powerful tools. They give doctors this amazing ability to fine-tune the body's core operating system. But because that system runs through your entire body, you just can't treat one organ in a vacuum. You always have to consider the whole person.
So it kind of leaves you with this one last thought, right? We've seen how these drugs are like master keys that can fit the locks of the body's most fundamental control systems. We've talked about the eyes and the lungs, but they affect the heart, the gut, so much more. It really makes you wonder, what other doors could these keys unlock? Or maybe, more importantly, what other doors might they lock by mistake?